Sarah's doctor handed her lab results with a concerned look, and said her white blood cell count was elevated above the normal range of 4,000 to 10,000 per microliter. She panicked, thinking the worst. But when she learned to read her CBC properly, she discovered it was just a sign her body was fighting off a minor infection. Nothing serious. Most people get their blood work back and have no idea what those numbers actually mean. Today, I'm going to show you exactly how to decode your complete blood count so you can feel far more confident about your results. By the end, you'll read your CBC results confidently, no more guessing or panic. Let's start with the component that causes the most confusion and anxiety. Your white blood cells operate like a sophisticated security force patrolling your bloodstream, with each type specialized for different threats. When you see that total WBC number on your lab report, you're looking at the combined count of 5 distinct cell types working together. Your white blood cell counts naturally fluctuate about 20% during the day, according to Cleveland Clinic data. Drawing blood in the afternoon versus morning can show significant differences in the same healthy person. This natural rhythm explains why some people get flagged for elevated counts when they're actually normal for that time of day. Most variations fall into the monitoring category rather than emergency territory. A white blood cell count of 12,000 with normal percentages usually reflects recent illness, stress, or medication effects. Slight increases in eosinophils during allergy season are expected. Lymphocyte percentages shifting from 25 to 35% might indicate your body fighting off a cold virus. While white blood cells reveal how well your immune system responds to threats, your blood carries another equally critical story about how efficiently oxygen reaches every cell in your body. Decoding your oxygen transport system. Red blood cell count measures the actual number of oxygen-carrying cells in each microliter of your blood. Hemoglobin tells you how much of the iron-rich protein exists to bind and transport oxygen throughout your body, and hematocrit shows what percentage of your blood volume consists of red blood cells rather than plasma. Dehydration creates one of the most common misinterpretations in red blood cell analysis, making your red blood cell count, hemoglobin, and hematocrit appear falsely elevated, while overhydration dilutes your blood and makes these values appear lower than they actually are. High-altitude living triggers legitimate increases in red blood cell production as your body adapts to lower oxygen levels. However, fatigue with normal or only slightly low hemoglobin might indicate other causes. Dehydration can make you feel exhausted while artificially elevating your red blood cell measurements. Thyroid problems, vitamin D deficiency, or sleep disorders often cause fatigue without affecting your oxygen transport system. Chronic kidney disease reduces red blood cell production, but this shows a specific pattern of gradually declining counts over time rather than sudden changes. Your blood carries one more critical component that often gets overlooked on CBC reports, yet these microscopic fragments hold vital information about your body's ability to heal and protect itself from injury. Your blood's clotting code. Labs rarely account for this timing factor when flagging abnormal results, leading to unnecessary concern when evening blood draws show elevated counts that would be normal for that time period. Lab artifacts can create falsely abnormal results, with EDTA anticoagulant in purple top collection tubes causing platelets to clump together and appear dangerously low when actual levels are normal. According to StatPearls, this pseudothrombocytopenia requires repeat testing with different anticoagulants to reveal accurate counts, but many patients experience unnecessary anxiety before this correction occurs. Certain foods and supplements can temporarily suppress platelet production or function. Dark chocolate, red wine, and foods high in salicylates like berries can reduce platelet stickiness for several hours after consumption. Bleeding risk correlates more closely with platelet function than absolute numbers. Extremely low counts require urgent medical attention due to serious hemorrhage risk. Easy bruising with normal counts usually indicates platelet dysfunction rather than low numbers. Prolonged bleeding after dental work or surgery suggests functional problems even when counts appear normal. Mastering your CBC for health optimization. Now you can apply this knowledge to optimize your health through strategic CBC interpretation. Reading your CBC components together reveals health patterns that individual numbers cannot show on their own. Always compare your results with the specific reference range provided by the laboratory that performed your test, rather than using generic ranges found online. Your personal baseline matters more than population-based reference ranges for long-term health tracking. Test at the same time of day when possible, as white blood cell counts naturally fluctuate throughout the day. Avoid intense exercise for 24 hours before testing, since physical stress can double neutrophil counts. Chronically elevated white blood cells suggesting ongoing inflammation could guide dietary changes toward anti-inflammatory foods and stress reduction techniques. High red blood cell counts in athletes might indicate the need for adjusted training intensity or altitude acclimatization protocols. Sarah's transformation illustrates this empowerment perfectly. Initially panicked by elevated white blood cells, she learned to interpret the complete pattern showing bacterial infection her body was successfully fighting. Second, track your personal baselines over time, since your individual trends matter more than population reference ranges. Third, ask informed questions about your specific values and trends at medical appointments. If you found this video helpful, please share to someone you love. Thank you very much for watching.